Good morning, everyone, and thank you for being here today. I am Yared Addis, and I'm excited to present my research on triage inaccuracy and associated patient factors at Emergency Department in Leku Hospital, Sidama Region, Ethiopia. This study was completed in December 2022 in Hawassa, Ethiopia. Over the next few minutes, I'll walk you through the key aspects of our findings, including the challenges in triage accuracy and the patient factors that influence it. Let's get started. Welcome to Slide 2. Here, I'll walk you through the main sections of our presentation. We'll start with an overview of the introduction, where I'll explain the background and significance of our study. Then, I'll outline the specific objectives we aim to achieve through this research. Next, we'll look at the methods and materials we used, giving you a sense of how we conducted our work. Moving on, I'll highlight the key results and discuss what they mean in the context of our study. After that, I'll talk about the strengths and limitations we encountered, providing a balanced perspective. We'll then summarize our main conclusions and offer some recommendations for future work. Finally, I'll acknowledge the contributions of those who supported us along the way. This outline ties everything together and guides us through the presentation, ensuring you understand the flow of our research. Let's take a closer look at the introduction to emergency situations. When we talk about emergencies, we're referring to sudden physiological, physical, or psychological impairments that require immediate, essential, and proper management. These situations can arise unexpectedly and demand swift action to prevent deterioration or even save lives. Emergency cases often arrive at the emergency department with various conditions, and sometimes the urgency isn't immediately clear. That's why effective triage is so critical. Triage is essentially the process of sorting patients based on their needs so that those who require urgent care are prioritized appropriately. Identifying the severity of each case is a key step in this process. By rating how serious a patient's condition is, we can determine who needs to be seen first. This ensures that the most critical patients receive prompt attention, which is fundamental to delivering effective emergency care and optimizing outcomes. So, understanding these principles helps us to manage emergency situations more efficiently and ensures that every patient gets the right care at the right time. Let's talk about inaccurate triage and why getting it right is so important. Accurate triage is essential because it helps us identify severely ill patients quickly, especially when the patient flow is crowded. This timely identification can really make a difference in patient outcomes. As Frickberg pointed out in 2005, being able to distinguish those who need urgent care from those with less critical conditions is vital for effective emergency response. But what happens if the triage system isn't accurate? Well, that's where problems start to arise. There are two main errors we need to be aware of: under-triage and over-triage. Under-triage occurs when seriously ill patients are not identified correctly and therefore don't receive the prompt care they need. Over-triage, on the other hand, happens when patients who are less severely ill are mistakenly classified as needing urgent attention. According to Gilby and colleagues in 2020, these errors can lead to significant issues in patient management and resource allocation. So, maintaining an accurate triage process is not just about sorting patients. It's about making sure everyone gets the right level of care at the right time, which ultimately supports the overall goal of effective emergency care. Accurate ED triage plays a crucial role in improving the efficiency and quality of emergency care. When triage is done precisely, it can actually reduce healthcare expenditure by about 15.3 to 17.3%. That's a significant cost saving, which benefits both the healthcare system and patients. In addition, proper triage helps decrease crowding in the emergency department by as much as 54.4%, according to Fitaha and Hamza. Fewer patients waiting around means less congestion, which can lead to faster care for everyone. Speaking of waiting, accurate triage also reduces the time patients spend waiting for care, as noted in research by Toomey and colleagues. When patients are prioritized correctly, those who need urgent attention get it sooner, improving overall outcomes. And perhaps most importantly, accurate triage can prevent potentially avoidable complications, including clinical issues, mortality, and morbidity. Uakova and Wolf highlighted that better triage practices can save lives and reduce preventable health problems. At Leku Hospital, they've adopted a 5-level triage system, which is a common approach worldwide. However, it's worth noting that, so far, they haven't yet assessed how accurate their triage process really is. That's an important step to ensure the system's effectiveness and improve patient safety. So overall, accurate triage isn't just about sorting patients. It's about optimizing resource use, reducing wait times, and ultimately saving lives. It's a key piece in making emergency care more effective and sustainable. Let's take a closer look at some of the key factors that contribute to triage inaccuracy. First, we have the chief complaints, which are the patient's main issues like chest pain, abdominal pain, or fever. These are often the starting point for assessment, but they can sometimes be misleading or incomplete. Next, vital signs play a crucial role. Things like pulse rate, oxygen saturation, body temperature, and systolic blood pressure provide objective data that helps us gauge the patient's condition more accurately. These measurements can reveal underlying problems that might not be immediately obvious from the chief complaint alone. Moving on, demographic factors, such as age, are also important. Age can influence how we interpret symptoms and vital signs because different age groups may show different responses or risks. Then there's the level of consciousness, which is a vital factor to assess. Changes here can indicate serious neurological issues or systemic problems, so understanding a patient's consciousness level helps in making appropriate triage decisions. Pain availability is another key aspect. Knowing whether the patient is experiencing pain and how severe it is can guide urgency and the need for immediate intervention. Finally, trauma factors are critical. If trauma is present, it often changes the priority and approach to care, emphasizing the need for rapid assessment and intervention. All these patient factors, chief complaints, vital signs, demographic details, consciousness, pain, and trauma, are interconnected. They form a conceptual framework that highlights how variations and inaccuracies in assessing these areas can lead to triage errors. Understanding this helps us improve the accuracy of our assessments and, ultimately, patient outcomes. Today, I will be discussing the general objective of our study, which is to assess triage inaccuracy and the patient factors that are associated with it at the emergency department of Leku Hospital in the Sidama region of Ethiopia in the year 2022. Our aim is to understand how accurate the triage process is, as this is crucial for ensuring patients receive timely and appropriate care. Additionally, I will outline the specific objectives of our research. First, we want to evaluate the reliability of the triage system at Leku Hospital's emergency department. This means looking at how consistent and dependable the triage process is across different cases and personnel. Next, we aim to determine the level of triage inaccuracy. That is, how often and to what extent patients might be misclassified during triage, which can impact their treatment outcomes. Finally, we seek to identify patient factors that might be associated with triage inaccuracies. This involves examining characteristics such as age, severity of symptoms, or other demographic factors that could influence the accuracy of triage decisions. All these objectives are interconnected and contribute to our broader goal of improving emergency care quality by understanding and addressing triage challenges. Today, I will be discussing the study area where this research took place. Leku Hospital is one of the 21 hospitals in the Sidama region, serving as a key healthcare facility in the area. This setting gives us a good context for understanding the scope and relevance of our study. Moving on to the study design and period, we conducted an institutional-based cross-sectional study. This means we looked at data collected at a specific point in time, from May to June 2022. This timeframe allowed us to gather relevant information efficiently and effectively. Regarding the source and study population, we focused on all patients who visited the emergency department over a 1-year period. This includes everyone who came to the ED during the study period, ensuring we captured a comprehensive and representative sample of the patient population. Finally, in terms of methods and materials, we used these to systematically collect and analyze the data. The approach was designed to be thorough yet practical, enabling us to draw meaningful conclusions about patient patterns and healthcare delivery in this setting. All these elements come together to support our overall goal of understanding emergency care in this region. Now, moving on to the methods and materials, let's talk about the inclusion and exclusion criteria first. We included adult patients, specifically those aged 15 years and above. It's important to note that we excluded patients with insufficient medical records, as well as those who absconded or were referred elsewhere. These exclusions help ensure the accuracy and completeness of our data. Next, let's discuss how we determined our sample size. We calculated it based on each specific objective of the study, and then we took the largest of those calculations to be our final sample size. The calculation was done using the single population proportion formula, which is a common approach in studies like this. For our parameters, we used a proportion of 0.5, which is a conservative estimate that maximizes the sample size. We aimed for a 95% confidence level, meaning we're quite confident in our results, and a 5% margin of error, which is standard in most research. Finally, we applied a correction formula to account for the population size, and this brought our final sample size to 364 participants. This thorough process helps ensure our findings are statistically sound and representative of the population we're studying. On this slide, I'll walk you through the sampling technique we used for our study. Over the period from September 2020 to September 2021, an average of 557 patients visited the emergency department each month. To select our sample, we employed a systematic sampling method. Our goal was to pick 364 samples from these visits. Now, to determine how often we should select a patient, we calculated the sample fraction, which is the total number of patients per month divided by our desired sample size. So, 557 divided by 364 gives us approximately 1.53, which we round to 2 for simplicity. This means, roughly, we select every second patient. The process started by choosing the very first patient randomly, using a lottery method to ensure fairness. Once that first patient was selected, we then continued by selecting every other patient, so every second patient, until we reached our total sample size of 364. This approach ensures that our sampling was both systematic and unbiased, helping us get a representative subset of the patient population for our analysis. And that's how we maintained consistency and randomness in our sampling process, which is crucial for the validity of our study. Now, let's look at how we collected our data. We used the Leku Hospital Triage tool, which is designed to standardize the assessment process. To ensure accuracy and reliability, 2 nurses and 2 physicians participated in the data collection. When patients arrived at the emergency department, 2 nurses performed independent and simultaneous triages. This means each nurse assessed the patient separately at the same time, allowing us to compare their assessments directly. After a 24-hour period, the physicians reviewed the same patients and made their triage decisions. These physician decisions served as our standard reference or gold standard for evaluating the accuracy of the nurses' triage assessments. By comparing the nurses' triage results with the physicians' decisions, we could determine how accurate and consistent our triage process was. This approach highlights the importance of using standardized tools and multiple assessments to improve triage accuracy, which is essential for effective patient management and resource allocation in the emergency setting. Now, moving on to the methods and materials, let's focus on the variables we're studying. The main dependent variable here is triage inaccuracy, which is what we're trying to understand and predict. To do that, we look at several independent variables. First, demographic characteristics, specifically age, because age can influence how patients present and how accurately they are triaged. Then, we consider vital signs such as body temperature, systolic blood pressure, pulse rate, respiratory rate, and oxygen saturation. These are critical clinical indicators that can impact triage decisions. We also look at chief complaints like chest pain, fever, and abdominal pain, since these symptoms often guide urgency and prioritization. Additionally, the presence of trauma is an important factor because trauma cases can complicate assessments and influence triage accuracy. Finally, we consider the pain that the patient feels due to their illness. Pain levels can affect both patient presentation and clinician assessment, making it an essential variable in our analysis. Altogether, these variables help us understand what influences triage accuracy and ultimately improve patient outcomes. Now, let's take a closer look at operation definitions. First, we have reliability, which refers to the triage agreement between two nurses. Essentially, this measures how consistently two nurses assess the same case, ensuring that our triage process is dependable. Next is accurate triage, which compares the initial nurse's assessment with that of physicians. This helps us evaluate how well our nurses' judgments align with medical professionals, ensuring patient safety and appropriate care. Moving on to data quality control, we emphasize the importance of using experienced and trained data collectors. Their expertise helps maintain the accuracy of our data collection process. We also regularly check for consistency and completeness to ensure our data is reliable and comprehensive. For data entry and cleaning, we use Epidata and SPSS, respectively. Epidata helps us efficiently enter the data, while SPSS allows us to clean and analyze it effectively. These methods are crucial for maintaining high-quality data throughout our study. Connecting all these points, it's clear that rigorous standards in reliability, accuracy, and data management are vital for the integrity of our research and the validity of our findings. Now, let's move on to the methods and materials we used for data analysis and ethical considerations. For the data analysis, we employed Epidata version 3.1 along with SPSS version 20. These tools helped us organize and analyze our data effectively. We calculated frequencies, percentages, and ratios to describe our data sample comprehensively. Additionally, we applied the Kappa inter-rater agreement test to assess the consistency between different raters, ensuring our data's reliability. We also carried out both bivariable and multivariable logistic regression analyses to identify factors significantly associated with our outcomes of interest. Turning to ethical considerations, obtaining ethical clearance from the Institutional Review Board was a crucial step to ensure our study adhered to ethical standards. We also secured a permission letter from Leku Hospital to conduct our research within their facility. Importantly, we obtained informed consent from all participating patients, making sure they were aware of the study's purpose and their rights, which upholds the ethical integrity of our work. These steps are vital to maintain transparency, protect participant rights, and ensure our research is conducted responsibly, all of which support the overall integrity of our study.